I need to tell you something that has been bothering me for a long time. There is a very good chance that right now, in your bathroom cabinet or on your kitchen counter, there is a medication you take regularly. Maybe every day, maybe several times a week. A medication you picked up without a second thought, or that your doctor prescribed years ago and you have been refilling ever since. A medication you consider completely safe because it is common, because you have taken it for years without anything obviously going wrong, or because it is available without a prescription. And that medication may be quietly damaging your heart. I know that is a serious thing to say. I do not say it to frighten you. I say it because I have spent more than 20 years as a physician watching what happens to older adults when this information does not reach them in time. And I have made a decision that I am no longer willing to stay quiet about what I have seen. My name is Dr. William Madison, and today I am going to walk you through 5 types of medication that research has directly linked to heart problems in adults over 60. Some of these are prescription drugs. Some of them you can buy right now without anyone asking your name. All 5 of them are taken by millions of people every single week who have no idea what these medications may be doing to their heart over time. I want to be completely clear about something before we go further. I am not telling you to stop taking any medication on your own. Do not do that. Stopping certain medications suddenly can be more dangerous than continuing them. What I am doing today is giving you information so that you can have a smarter, more informed conversation with your doctor, so that the next time you sit across from your physician, you are not just a passive patient waiting to be told what to do. You are someone who understands what is in your body and why it matters. Because here is the truth that nobody in medicine talks about enough. Every medication is a balance. Benefits on one side, risks on the other. That balance looks different at 65 than it did at 45. The risks that were acceptable when you were younger may not be the same risks your heart can handle now. And if nobody is regularly reviewing that balance with you, your heart is the one paying the price. Stay with me through all 5 medications, especially the second one on this list, because that one is going to stop you. It is marketed specifically as something that protects you. And the truth about what it may actually be doing to your heart is something most people never hear until something goes wrong. Let us start with the medication that is sitting in more homes than almost any other pill on earth. Anti-inflammatory pain relievers. The ones you know as ibuprofen, naproxen, and diclofenac. You probably have at least one of them somewhere in your house right now. They are the first thing most people reach for when their back hurts, their knees ache, their arthritis flares up, or a headache will not go away. They work well. There is no argument about that. When you take one and the pain eases, that is a real and genuine effect. But here's what nobody tells you when you buy them. Taking these pills regularly after the age of 60, especially if you have any heart concerns at all, is one of the riskier things you can do to your cardiovascular system. And the medical community has actually known about this for 20 years. The FDA required warning labels about heart attack and stroke risk on these medications back in 2005. That was 2 decades ago. And still, most people take them as freely as they take vitamins. I want to tell you about a patient I will call Robert. He was 72 years old. He loved gardening. He had knee arthritis that had bothered him for years, and he had been taking ibuprofen almost every day to manage the pain well enough to keep doing the thing he loved most. It seemed like a reasonable trade. One afternoon, while he was working in his garden, he felt a heaviness settle over him that he had never felt before. He could not catch his breath. By the time he reached the emergency room, his ankles were swollen to twice their normal size. His heart was in acute failure. Not because he had a new heart disease, because his heart, already working harder than it used to because of his age and mildly elevated blood pressure, simply ran out of capacity to cope with what the ibuprofen was doing to it. Here's the mechanism in plain language. These medications block certain proteins in the body to reduce inflammation and pain, but those same proteins also protect your kidneys and blood vessels. When you block them, your body starts holding on to extra salt and water. More fluid in your body means more fluid your heart has to pump. For a young, healthy heart, that extra load is manageable. For a heart that is already dealing with the natural stiffening that comes with age, that extra load can push it past its limit. At the same time, these medications cause blood vessels to tighten. Your heart now has to push blood through narrower tubes with more fluid in the system. Blood pressure goes up. If you are already taking medication to control your blood pressure, these pain relievers can make that medication significantly less effective, and in some cases cancel it out almost completely, without you feeling anything different until something serious happens. There is one more detail that matters, especially if you take low-dose aspirin to protect your heart. Certain anti-inflammatory drugs, particularly ibuprofen, can block the protective effect of aspirin entirely. The aspirin you are taking specifically for your heart may not be doing anything, because the ibuprofen you took this morning got there first. The solution is not to suffer through pain. It is to have an honest conversation with your doctor about what the safest pain management option looks like specifically for you at your age, with your health history. There are alternatives. Acetaminophen works differently and does not carry the same cardiovascular risks. Topical anti-inflammatory creams that work directly at the site of pain without entering the bloodstream in the same way are another option for many people. If an anti-inflammatory pill is truly necessary, the principle is the lowest dose for the shortest possible time. That conversation is worth having. Your heart is worth that conversation. Now we arrive at the second medication. And I need you to pay close attention here because this one carries a specific kind of danger that makes it harder to recognize than the others. Proton pump inhibitors. You know them by names like omeprazole, pantoprazole, and lansoprazole. These are drugs prescribed for acid reflux, heartburn, and stomach protection. They are among the most commonly prescribed medications in the world. Millions of people take them every morning as a routine, the way other people take a vitamin, without thinking twice about it. And here is the bitter irony that I find genuinely troubling. For many people, these stomach-protecting medications were prescribed partly to protect the stomach from the very anti-inflammatory pills we just discussed. One medication creating a problem, another prescribed to manage that problem. And in the process, a second, less visible risk developing quietly in the background. I want to tell you about a patient I will call Eleanor. She was 68 years old. She had been prescribed omeprazole for chronic acid reflux and told she would likely need it long-term. The reflux disappeared. She felt fine. She refilled the prescription without discussion for years. Then, during a routine checkup, her electrocardiogram showed an irregular heart rhythm. Blood tests told the story. Her magnesium levels had dropped to a dangerously low level. Magnesium is not a mineral most people think about in connection with the heart, but it is one of the most important minerals your heart depends on. Magnesium controls the electrical signals that tell your heart muscle when to contract and when to relax. When magnesium is too low, those electrical signals become unstable. The heart can develop arrhythmias, which are irregular rhythms that in some cases can become life-threatening. The cause of Eleanor's magnesium deficiency was the omeprazole she had been taking faithfully for years. Here is why. These medications work by reducing the acid in your stomach. But stomach acid is not just there to cause problems. It plays a critical role in absorbing certain minerals, including magnesium. When you suppress stomach acid long-term, your body loses the ability to absorb magnesium efficiently from the food you eat. The deficiency develops slowly, over months and years, without any obvious symptoms, until the level drops low enough to affect the heart. There is more. Research has found an association between long-term proton pump inhibitor use and increased risk of heart attack. The proposed mechanism involves nitric oxide, a molecule that keeps blood vessel walls relaxed and flexible. Some evidence suggests these drugs may reduce nitric oxide levels over time, causing blood vessels to stiffen and become more vulnerable to blockage. There is also a direct drug interaction concern that is critically important for anyone who has had a heart attack or a stent procedure. Omeprazole specifically can interfere with clopidogrel, a blood-thinning medication given after cardiac events to prevent further blockages. When omeprazole is taken alongside clopidogrel, it can reduce the blood thinner's effectiveness significantly, leaving the patient with far less protection than they and their doctor believe they have. These drugs were designed for short-term use, 4 to 8 weeks to address a specific problem. They have become, for many people, a permanent daily habit that was never intended or properly reviewed. If you have been taking one of these medications for months or years, please do not stop it suddenly. Talk to your doctor. Ask whether you still need it. Ask whether your magnesium levels have been checked recently. Ask whether there are lifestyle changes or different treatments that could address the underlying issue without the long-term medication. That conversation may be one of the most important ones you have this year. The third medication on this list is one that is sold everywhere without a prescription. No doctor's visit required, no questions asked. You can pick it up at a petrol station or a supermarket. And for people over 60 with any heart history at all, it deserves serious caution. Oral decongestants, the ones containing pseudoephedrine or phenylephrine. These are the active ingredients in most cold and flu tablets and capsules that promise to clear a blocked nose. When you are congested and miserable and struggling to breathe comfortably, these medications feel like a solution. And in the nose, they are. They narrow the blood vessels in the nasal passages, reduce swelling, and allow air to move through. But these medications do not stay in your nose. Once swallowed, they travel through your entire bloodstream and narrow blood vessels throughout your whole body. Every artery, every blood vessel, not just the ones in your nose. This creates two serious problems for an older heart. The first is blood pressure. When blood vessels throughout the body narrow, the heart has to push blood against much greater resistance. Blood pressure rises, sometimes sharply and rapidly. For someone whose blood pressure is already on the higher side, this spike can be genuinely dangerous. For someone whose blood pressure is controlled by medication, the decongestant can overwhelm that control and send pressure to levels their medication was never designed to handle. The second problem is heart rhythm. These ingredients are stimulants. They speed the heart rate and can make the electrical rhythm of the heart less stable. For a heart that is already managing mild abnormalities in its rhythm, that additional stimulation can push it into a more serious arrhythmia. I remember a patient, a 75-year-old retired teacher, who took a common cold medication containing pseudoephedrine for a blocked nose. By the second day, she felt her heart pounding in her chest in a way that frightened her. Her son drove her to the hospital. Her blood pressure had spiked dramatically, and her heart had developed an irregular rhythm. She was in a stable condition, but she had been genuinely close to a serious cardiac event. Triggered by a cold tablet she bought without a prescription. If you are over 60, and especially if you have any history of high blood pressure or heart disease, avoid these medications completely. There are safe alternatives for nasal congestion. Saline nasal rinses. Steroid nasal sprays that work locally in the nose without entering the bloodstream in the same way. Steam inhalation. These options address the congestion without placing that cardiovascular strain on your heart. A blocked nose is uncomfortable. It is not worth a cardiac emergency. The fourth medication requires a careful and caring conversation. Because the condition it treats, depression and chronic nerve pain, is real and genuinely affects quality of life. But the specific class of medication I am referring to can affect the heart in ways that need to be openly discussed. Tricyclic antidepressants. You may know them by names like amitriptyline or imipramine. These are older antidepressants that have been used for decades. They are still prescribed today, sometimes for depression, and perhaps more commonly for nerve pain, which is the deep burning or electric pain that often accompanies conditions like diabetic nerve damage. Depression is itself a risk factor for heart disease. Chronic pain significantly reduces quality of life and independence in older adults. These are real problems that deserve real treatment. I want to be honest about that. But these specific medications carry three distinct risks for the aging heart that make them a concern in older adults. The first risk is a sudden drop in blood pressure when standing up. When you move from sitting or lying down to standing, your body has to quickly adjust blood pressure to keep blood flowing to your brain. Tricyclic antidepressants interfere with this adjustment. The result is called orthostatic hypotension, and it means blood pressure drops too quickly when you stand. The consequence is dizziness, lightheadedness, and in some cases fainting. For an older adult, fainting means falling, and falling means the risk of fractures, head injuries, and the chain of consequences that can follow a serious fall. I had a patient in his late 70s taking a low dose of amitriptyline for nerve pain in his feet. It helped the pain noticeably, but he began getting dizzy every time he stood up from a chair. One morning he fainted in the bathroom and fractured his hip. A medication that was helping one problem created a direct pathway to an injury that took months to recover from, and permanently changed what he was able to do independently. The second risk is an elevated resting heart rate. These medications tend to speed the heart up slightly. A heart that is beating faster at rest is a heart under continuous additional strain, every hour of every day. Over time, that constant extra demand adds up. The third risk is the most serious. Tricyclic antidepressants can interfere with the electrical system of the heart. They slow the electrical impulses that coordinate the heartbeat. This shows up on an electrocardiogram and, in susceptible individuals, can increase the risk of a dangerous type of irregular heart rhythm called a ventricular arrhythmia. In some cases, these arrhythmias can be life-threatening. Safer alternatives for both depression and nerve pain exist. Modern antidepressants have much more favorable heart safety profiles for older adults. If you or someone you care about is taking amitriptyline or a similar medication, please talk to the prescribing doctor about whether the cardiac risks have been weighed against the benefits, whether safer alternatives have been considered, and whether heart rhythm is being monitored appropriately. The fifth and final medication is the one I expect to generate the most surprise. Because for decades, the message around this medication has been almost entirely positive. You have probably been told to take it. You may have been told you are not taking enough of it. Calcium supplements. The pills taken by millions of adults specifically to protect their bones from osteoporosis. The supplements recommended widely as a fundamental part of aging well. I am not going to tell you that protecting your bones does not matter. It matters enormously. Fractures in older adults, particularly hip fractures, are serious events with serious consequences. Bone health is a genuine priority. But the story of calcium supplements in the heart is more complicated than the simple positive message most people have heard. And the complication is significant enough that I believe every person taking these supplements deserves to know about it. Here is the distinction that the research keeps returning to. Calcium obtained from food, from dairy, from leafy green vegetables, from other dietary sources, does not appear to carry the same cardiovascular concern. When calcium comes from food, it is absorbed gradually, in amounts the body can use efficiently, spread across meals throughout the day. Calcium from supplements works differently. When you take a calcium supplement, particularly a high-dose one, it creates a sudden spike of calcium in the blood. The level rises higher and faster than it does from food. Your body cannot use all of that calcium immediately for bone building. The excess has to go somewhere. The concern, supported by several large studies, is that this excess calcium can deposit in the walls of the arteries, a process called arterial calcification. Arteries that accumulate calcium deposits become stiffer and less flexible. Blood pressure rises. The risk of plaque formation, the kind of plaque that blocks arteries and causes heart attacks, increases. Some major research studies have found that calcium supplements modestly but measurably increase heart attack risk, particularly in women over 60. The research is not entirely settled. Other studies have not found the same connection. And for someone with severe osteoporosis whose bone fracture risk is high and immediate, the benefit of supplements may genuinely outweigh the cardiac concern. But the fundamental lesson is clear and important. More is not always better. Taking calcium supplements without a specific medical reason, without your doctor being aware of your cardiovascular risk profile, and without regular reassessment, is a decision that deserves more scrutiny than most people have given it. If you are currently taking calcium supplements, do not stop them on your own today. But at your next doctor's appointment, have this conversation specifically. Ask whether you still need them, and at what dose. Ask whether your calcium needs could be met through diet instead. Ask how your bone health risk compares to your cardiovascular risk, and whether that balance is being considered. Ask whether your doctor is aware of your supplement use in the context of your full heart health picture. The safest strategy for most people is getting calcium primarily from food, and only supplementing under specific medical guidance, at the lowest dose that achieves the bone health goal. Let me bring all 5 of these together, because the picture they create collectively is important. Anti-inflammatory pain relievers that force the heart to work harder, raise blood pressure, and cancel out the protection of aspirin. Stomach-protecting proton pump inhibitors that silently deplete magnesium, destabilize heart rhythm, and interfere with blood-thinning medications. Cold and flu decongestants that constrict blood vessels body-wide and accelerate heart rate in ways that can trigger dangerous events. Older antidepressants that cause blood pressure drops, increase resting heart rate, and disrupt the electrical system that keeps heart rhythm stable. And calcium supplements that may deposit in artery walls when taken in concentrated supplement form rather than obtained through food. None of these medications are universally dangerous. Many of them, in the right person at the right dose for the right period of time, provide genuine and important benefits. The problem is not the medications themselves. The problem is when they are taken without regular review, without a clear understanding of what they are doing in an aging body, and without an honest weighing of the risks against the benefits at the specific stage of life the person is in. Your heart has been working for you every single moment of your entire life, without rest, without a break, for 60, 70, 80 or more years. And the demands your heart faces at 65 are different from the demands it faced at 45. The medications that were reviewed and considered appropriate at 45 may not have been reviewed since then in the context of how your heart and body have changed. You deserve that review. Your heart deserves that level of attention. Here's what I want you to do before your next doctor's appointment. Write a complete list of every pill, every supplement, and every over-the-counter medication you take regularly. Everything. Not just the prescriptions, the vitamins, the supplements, the pain relievers you take a few times a week, the stomach pill you take every morning. All of it. Bring that list to your appointment and say these words. I would like to go through this list with you and understand whether each of these is still the right choice for my heart health at my age. That is not a difficult or confrontational request. It is one of the most responsible things a patient over 60 can do for themselves. Any physician worth seeing will welcome that conversation. The people who protect their hearts most effectively are not the ones who never get sick or never need medication. They are the ones who stay informed, ask good questions, and treat every prescription and every pill as a decision that deserves to be revisited as they get older. If something in this conversation surprised you, if you heard the name of a medication you are currently taking and felt a need to know more, please do not sit with that alone. Write the question down, bring it to your doctor, ask it clearly and directly. You are entitled to a clear and direct answer. And if you know someone, a parent, a partner, a friend, who takes any of the medications we discussed today without fully understanding what the research says about them and the aging heart, share this with them. Not to frighten them, to give them the information they need to have a smarter conversation with their own doctor. Knowledge is not the enemy of trust in medicine. Knowledge is what makes the partnership between a patient and a physician actually work. I'm Dr. William Madison. Your heart has worked hard for you. It is time to work just as hard for your heart. Take care of yourself, take care of the people around you, and I will see you in the next video.